my name is Anna and today I want to talk about congenital heart defects. The heart is the most important organ in the circulatory system. It fulfills the function of carry out a series of coordinated contractions to produce a pressure that is capable of moving the blood throughout the body, throughout the arteries, veins, and capillaries. The heart is the first organ to develop in the human body, specifically 3 weeks after conception. It is composed of 4 main structures: 2 ventricles that are located inferiously, 2 atria located superiorly, which are separated by a septum. In the case of the right ventricle and right atria, there is desoxygenated blood that will pass through the lungs to be oxygenated, and in the case of the left atria and left ventricle, there is oxygenated blood that will be distributed to the rest of the body. Anatomically, the heart is located on the left side of the rib cage. Well, talking about congenital heart defects, these are the most common type of birth defects, consisting of structural malformations of the heart and blood vessels. And among these types of malformation and defects, the most common are interventricular communication, followed by intraatrial communication, patent ductus arteriosus, pulmonary stenosis, among others. In this case, we will only talk about the 3 most common heart defects. In the first place, we have interventricular communication, which occurs in the first stages of embryologic period, and this consists of a lack of separations of both ventricles, resulting in an exchange between ventricles of oxygenated blood and desoxygenated blood. In the case of the interatrial communication, this also occurs in the first stages of embryologic period and consists of a non-existent separation of the atria, and these communications between the atria allows the communication between the blood, oxygen-rich blood combined with low desoxygenated blood, causing lung problems over time. Both communications can be treated by surgery from birth. And finally, talking about the patent ductus arteriosus, this is a normal communication between the pulmonary artery trunk and the aorta, and once the baby is born, this connection needs to be closed, so the treatment for this malformation can be surgically treatment or prescribing indomethacin to induce or stimulate the close of this conduct or this connection. Finally, as a conclusion, it is so important to know how to identify these malformations to avoid later complications and provide a better quality life. Thank you so much for your time.